We're going to throw up a couple slides. Some of us are going to talk through, but we're going to make the most of the time that we've got left. So like Tim was saying, this presentation is about looking at that transitional period from both perspectives. So really learning how to bridge that connection. And it came about from my own experience at the VA, not really knowing what it looked like on the other side. And I'm sure there are people on the DoD side who aren't sure what the VA transition looks like. So we're going to go through that process. Of course, standard disclaimer, the views that are going to be expressed in this presentation are not the part of the Department of Defense, Department of Veteran Affairs, or the U.S. government. And so, thinking about this transitional period, we're looking at 200,000 service members are separating each year. So it's one of the few universal military experiences. So regardless of rank, regardless of occupation, you're going to go through some kind of transition process to leave the military. And what we know is that it is marked as an at-risk period. So we're looking at major stressors, changes, transitions in different aspects of life. And it's something that hasn't been as studied. So it's starting to be more studied. And there's actually a pretty interesting, we'll talk a little bit about the Veterans Metric Initiative a little bit further on, but there really hasn't been that much research to look into this transitional period. So the goals for today are threefold. So to just get you familiar with what the DoD programs and services are on that side. Likewise, describing the VA and the Transitional Care Management Program, and then talking a little bit more about the clinical issues that come up during this period. So we're going to ask if you do have questions, we're going to try to leave some time at the end. So if you have questions, feel free to type them in the box, and we'll get to those all together at the end. So without further ado, I will turn it over to Nate Ainspan.
Hi, thank you very much. Thank you for the opportunity to speak. I'm Nathan Ainspan. I'm a research psychologist with, as you can see at the bottom, the Military Civilian Transition Office, or MCTO. Next slide. And my office was combined between two programs that you've probably heard the acronyms for, the TAP, the Transition Assistance Program. This is the training that all the service members go through when they leave the military to become civilians. I'll go through the slides quickly so I can get to the main points. I'll make sure you have my email address or that you get the slides, because then they're full of other information that you can use for reference. Given 10 minutes to speak, I'll hit the high points. Next slide, please. So besides the TAP, my office was also merged with the Yellow Ribbon Reintegration Program, YRRP, and that's the training programs that reservists and guardsmen can receive to help them when they return from deployment, from activation, so they can understand their programs and services as well. Next slide. The idea that the programs were merged together because we both deal with service members becoming civilians, either full-time or as they roll in and out from activation, deactivations, mobilizations from the National Guard. What we explicitly are looking at, as Brian had mentioned, that difficult period that comes about as you leave the one tribe that you've identified so strongly with and become a civilian. I want to give you a brief overview because I've heard many clinicians are working one-on-one with the service members but don't really know the programs that got them to become a veteran or what they can recommend to their clients. So quickly, the TAP program was created in 2011 when we had the high unemployment rate for veterans. Veteran suicide was a big issue. And these agencies, plus any agency that touches military or veterans throughout the federal government, were organized together in an interagency partnership, DoD and the lead, naturally, to create the programming to improve the situation and to create all these programs and policies I'm about to mention. And if you realize that DoD is the biggest agency in the entire federal government, VA is the second largest, only by a few people, this is huge, that we can get the two largest agencies to work together on something. And also we are building that airplane while we're flying it. So the curriculum is being revised every year as it's being deployed to these 200,000 members. And it's no small task. And we do bring in SBA for small business, et cetera. And I'll show you. Next slide. Just quickly, as I mentioned, in 2011, the VOW Act changed the way that we were doing TAP. If you remember doing TAP in the 90s, it was death by PowerPoint, hadn't been updated in literally a decade. So my office was stood up to really work on the issue and keep it going. Since the VOW Act, we've been working extensively on this, and then in 2018, the President signed a new NDAA that significantly altered the TAP, and I'll show you in upcoming slides. Next slide. Okay, this is the heart of the matter of if you're a service member, what do you go through? And again, remember, this has been changed every year with a massive change from 2018 that was operationalized in about 2019. That being said, if you had a veteran who left in 2017, they had a different experience. And a year from now, if you have a veteran who's going to leave in 2021, they will have a different experience. Nothing has stayed the same with this. It's always being updated and changed, revised, and I'm proud to say a lot of research being done by colleagues at DoD, VA, RAND, and the other FFRDCs, and academia. Part of the reason my job was created was to bring in the research that's being done to conduct our own research, to advise the curriculum and the policy people what they're doing. So quickly to go through this, if you're a veteran, you need to be, or if you're a service member, sorry, you need to begin the transition process a minimum of 365 days. Or if you're an officer, because they know it will take longer and it's more complex, you have to begin 2 years prior to what your anticipated separation day would be. And it's fascinating because in DoD, we're the only organization that will pay you and train you to go to your next job. In no other job can you say like, hey, I'm going for an interview, I need your help. So it's unusual for DoD to be in that spot. And if you're a short-termer in the military, let's say 3 to 4 years, it took about a year to take you from the street to become a Marine, a soldier, airman, etc. And now if you're only in for 3 years, that's 1 year coming up to speed. And now you get to spend the third year coming off of speed. So we only really got 1 year of activity out of you. So the process begins with individualized counseling with a TAP center in your local installation. You also will do the individual transition plan to figure out what you want to do. Transition, we admit, is an individualized process. What one person wants to do is something that another one wouldn't. One may want to go to school, get a job, or you might want to just kick back and play video games in your parents' basement. Not recommended, but that's your goal. Our job as a TAP program is to give you the tools and resources so you can successfully operationalize and do what you intended to do and have the tools to do it successfully. So a year or 2 years ahead of time, you have the counseling, you start meeting, and you start beginning and talking about thinking about what you want to do. In the civilian world, we know that rule of thumb is it takes you about a month for every $10,000 of salary that you want to do a job search. So if you're thinking even for just quote unquote a $60,000 job, the rule of thumb is 6 months it'll take you to find that job. And that's like a dedicated full-time job search. These are members who are doing a full-time job while looking for their next job. So as you come close to your transition, you now go into the formal training. And it begins, and this is part of the new changes from 2 years ago, DoD Transition Day, which is a DoD class where we talk about what the transition process is like, what the emotions are like. We have crosswalks for your military occupation to figure out what, if you're an 11 Bravo in the Army, what would you want to do on the outside, and some of the financial training. There's also a second day where you look at your VA benefits and services, what you've earned, what you can use. And then you take a DOL one-day employment workshop, how to get a job, how to do a resume. And then after that, you can now pick your own adventure. And you can choose from among these other 2-day tracks that you can take, either on employment, if you're really interested in getting a job, if you're looking into education, using your GI Bill, if you want to start your own business, there's an entrepreneurial workshop. And then if you're interested in vocational training to become a plumber, electrician, etc., there's that training you can take as well. So you've got those trainings as well. And then as you progress, you don't leave the military until you go through capstone. And this was fairly revolutionary for it to begin. And this is where you sit down with your commander or commander designatee, and you check against your career, that you've met the career readiness standards. And that means you're good to go to leave the military. In the past, the story was, they'd talk to you about something, they'd send you out, and if you weren't ready to go, you'd be lost and drowning. This prevents this from happening. You do not take the uniform off until you talk to your supervisor or commander designatee. This has to occur no later than 90 days of preparation. So 3 months out, if in the review process, they realize you don't have a home lined up, if you still have some issues with finding a job, this gives DoD 3 months to connect you to services within the department. So counselors, other training programs, just being able to talk to others. If there are still issues, we have what's called a warm handover, which will be that the service member who may be lacking something will be physically introduced to a DOL or a VA representative based on the need. DOL for employment, VA psychological needs. You'll be introduced and say, hi, this is Bob with the VA. And then that gives you a face and a name that you can then reach out to for help. And again, this is while you're still in uniform. So when you leave, there should be no reason for not knowing at least where you can go for help. And then you'll also get a statement of benefits to be received about what you've earned. One thing to point out is for all these trainings, not only can the service members access them, but any veteran from any year, even like World War II, all these training modules are online. All the manuals and resource guides are online. So if you have a client looking for a job, you have these resources that they can access. Also, every veteran is eligible for employment help. They can go to the American Job Center. There's about 3,000 across the country and one in every community. And the AJCs or DOLs, agencies, that are set to provide job search assistance. And each one has specialists on helping veterans. So if you hear your clients say they need a job, send them to the AJC. If you have a client who needs additional psychological help, the VA has resources. DoD also offers the In Transition website and phone number that can provide anything from wanting to know about fishing licenses to suicide support even. They have had people call who want to kill themselves. They have trained counselors 24/7 who will talk them through it. So all these things are resources that you can direct your clients to. And I encourage you to do that because the research that we find shows a small percent, about half at any given time of veterans will use VA or DoD resources. And we're actually looking at different research about what barriers are preventing them. And a lot of it is the stigma. It's this idea that I can take that hill. We really encourage you to reach out to your clients and their families and get them to use these programs and encourage them. Carrie Kennedy, you may have heard of her, and she just came out with a book on trauma, who is also in the Navy, points out to the members and says, you have to work to earn your salary. You see all those therapists and counselors, they get paid if no one comes. So make them work for their paycheck and go and use these resources. Next slide, please. Quickly to talk about what makes up the TAP, you have the initial counseling, you go for the pre-separation counseling to make sure you know what you need to do to get where you want to go. You've got transition day, you got your training on the VA programs and services, you have employment, you then select your other different tracks and then go through capstone and hopefully good to go. Next slide. These are some of the details of the additional 2-day tracks that you can take. The employment has all the, the typical things about identifying skills, networking, branding, 30-second elevator speech. Vocational is if you'd rather go for a vocational job versus one that you might need a bachelor's or other degree for. So it's how do you get training? How do you evaluate which programs to use? What credentials do you need? Next slide. If you're interested in using your GI Bill, and that's usually the #1 reason after serving the nation that the service members said they wanted to join the military, really walks you through what do you look for in a university, choice of institution, what kind of field you want to do, and then how do you get in. Very much applied. If you're interested in starting your own business, there's the entrepreneurship module. And it walks you through the business plan, market research, what do you need to know legally, et cetera. And interesting, when they look at usage of this program, someone who takes the program but doesn't start a business is seen as a success, which might not be true for any of the other modules, because many times when you talk to the members who take the entrepreneurship program, they choose not to start their business at that time because they learned what it takes. And part of the lesson is you might want to work a few years to build up a nest egg that will then help you through the rough first few years of your own company. So an interesting note about that. And again, all these are available in some way or another online through the resources of the government to any veteran that you may be working with or any service member and their family members as well. Next slide, please. I mentioned you can't leave without the career readiness standards, and this is what they are. You have to have that individual transition plan that lays out what you want to do and how you'll do it. They make you register on the VAC benefits so you can at least be there to access your benefits. You want to complete military service and counseling. This is active. You want a financial plan that you can show to this evaluator that you do have a budget figured out. You'll look at your military occupation, what you want to do, and show that you know how to meet those gaps, that if you are X and want to do Y, I need to do Z to get there. Or if you have a job acceptance letter to show you're not, we're not going to let you leave unless we know you know how to look for a job or have a job. And then if you're interested in education or vocation, they want some proof that you've prepared for that. And then for employment, that you'll show a good resume or other verification of employment to show that you've got the chops, that you're ready to leave. Next slide. I mentioned the warm handover. This gets into more detail. It's a process where if they feel that you haven't met the CRSs, the readiness standards, you'll be introduced to counselors and others who can help you match that goal. We're also looking on using a tool, survey questions that the members will take at the 1 month mark, or excuse me, the 1 year mark, and then the 3 month mark that will get at psychological issues like hope, a good sense of the future, employment, housing, as an assessment, so that if anything comes out as a red flag, 1 year out, you're able to really work with the counselors, or 3 months out, when it would really matter, you can still work with the counselors or get that warm handover, a self-assessment to see where you might need some extra help. And then we will have resources that'll take you straight to that. Next one, please. And that's it for me. I look forward to your questions. I'll type my email address in there, and please feel free to reach out to me if you have any questions, and these slides will be distributed. Thank you very much.
We'll hand it over to Tim Hoyt, who will be speaking about clinical considerations from the DoD side.
All right, thanks a lot. So by way of quick introduction, I'm Tim Hoyt, I work for the Psychological Health Center of Excellence. If you remember nothing else from my presentation today, I want to pitch quick the In Transition program, which I'm not going to oversell it, will fix all of your problems. In Transitions existed for more than a decade to help facilitate transitioning service members, whether they're going between 2 different bases or going from the active duty to the veteran status and whatnot. And so please look it up now, In Transition, all one word, hosted by the Psychological Health Center of Excellence, and provides those resources regardless of duty status, regardless of discharge status, regardless of at what point they served in the military. So all of the above can be handled by that program. Now, with that, I'd like us to consider quickly adult development as it applies to military performance. At any point throughout a service member's career, and I think about my own career in the military as well, you can pretty well predict how they are doing based on that career trajectory. How they do in basic training determines often whether they're going to then go to airborne school, be considered for special forces. Those sort of factors determine where's their first duty station going to be, how quickly promotions are going to come, how quickly leader progression comes in, and then the trajectory around deployment. So in thinking about that, any deviations from that trajectory often provide opportunities for clinical intervention. If a soldier, for example, is recycled during their first time through basic training, they're sent back and said, you're not cutting it, but we're going to give you another chance. Even those sorts of things start to set off a different trajectory where often they're seeking different care. Similarly, the predictable trajectories for those who are separating from the service can include things like 85% of us will be discharged honorably. That is a fairly predictable sort of state. 25% are going to have some sort of rated disability. And then 5 or 6% are going to be separated for misconduct, which is one of those more difficult scenarios where they're getting out much more quickly. They may be eligible for fewer benefits, and we have to think about those things. Other common trajectories, you know, if they're sort of honorably discharging at the end of their term of service, there's some predictable ways that in the slides that Nate laid out, that you know, a senior officer is often going to retire, get some kind of DoD contractor job, stay with the community that he knows and loves. A junior officer often is going to just get a release from active duty, go into the reserve, work for a company like Amazon and go get a master's degree. More of our effort and whatnot goes toward your junior enlisted soldiers. They're leaving active duty after their first tour. They're returning home. Their plan might involve going back to the exact same job that they had pre-military because they still are in contact with their boss and whatnot. And thinking through some of those things with these service members often is one of the clinical things that we have to do. They're still reasonably young, and often they haven't had any other experience in terms of seeking a job. The military may literally be the only real job they've ever had. And so walking them through some of these things, still acting sort of as their frontal lobe during this time, often falls to clinicians who are saying like, well, have you thought through some of these things as you're going through the TAP process? Other common trajectories are your sort of retirement, you know, where they're at 20 plus years of service, and they might be thinking that they're set for life, but not be prepared for, you know, retirement pay honestly is only about a third of what they were taking home on a monthly basis due to, you know, the reduction in overall pay and the decrease in housing and benefits and whatnot. And so those sorts of things create more of a wrinkle that they have to think about and that they may not have planned for. One of your other common trajectories is medical discharge. So if they're going through the disability process, they're often much better tied to the VA so that they're in contact with the transition care manager. The unified or integrated disability system helps to make sure that they're making it across that chasm in a better way. In terms of reintegration, though, I think that's the primary challenge. And that's the sort of resumption developmentally of these age, gender, and culturally appropriate norms or roles in the family, the community, the workplace. And so if we think about the different domains of that reintegration, we find our areas where we can intervene. And those things happen both on Nate's side from transition and on my clinical side, where we're thinking about their psychological health, and we're thinking about their family and social and marital health, right? There's always going to be physical health concerns. I don't know anybody who I served with in the Army that didn't have some sort of Army-inflicted injury that they're still coping with. We're thinking about employment, housing, the financial pieces, education, which for almost all of us is something that we want to continue pursuing. Many will have or in some cases will have legal things that they have to worry about, whether that is as simple as reestablishing residence in another state as they go back home, or you know, unlawful behavior, criminal justice matters that may still be hanging over them. And then finally, just that spiritual or sense of purpose as part of reintegration. That's really getting around the idea of what is my identity now? So that's where one of the big problems clinically, I think, arises is we drill into these guys so much, this idea of autonomy, that I'm going to take care of things myself. If we're in a firefight, yes, I'm there to support my buddies, but I am not going to be the one that drags down the team by not carrying my load. And so the collective priority sort of shifts to taking care of their own needs. And that can result then in a mismatch. You know, the service member might say, well, I have this injury, I want to make sure and get that taken care of with surgery before I separate, right? And the military medical system might say something in certain cases like, well, no, we don't really think that surgical intervention is appropriate. If this progresses, you can get looked at the VA. And so there's that tension, right? Other things might happen. Involuntary separation. You know, is that perceived as like, yes, I'm ready to leave now, versus now is the time when you have to leave. If you did not prepare, that's on you now. There also may be a lot of problematic beliefs that we challenge clinically with how they view civilian life, employment, and school. Often in surveys, we've heard a lot of things like hiring managers on the outside don't understand the military, right? And we can start to challenge that. Like, well, how much understanding do they have to have? Do they need to know the details of, what the Stryker vehicle technical specs are? Or can they know that, you have had generally some leadership experience? Generally, we've been putting you in very critical decision-making types of scenarios, and that you can deal with those and apply those to novel situations. Those are valuable things that we get across to them that, yes, it's okay to mention your military service, but mention it in a way that promotes that idea that you are capable of a lot of amazing things that they might not see on the surface. The other piece is just that fear of being largely out of practice, whether that's out of practice for a job search because in a 20-year military career, you just went to where the military sent you for each of those stations, or from academia. If it's been 10 years since you've written a term paper, that can be something that's difficult to get back into. The other thing we hear a lot is this lack of structure. Right, and what does that mean if they have a lack of structure? I'm not convinced that it always means that the military gave me my structure in life, and now I'm adrift as I go into this new transition. But more of it, I think, means that they haven't established this routine. They haven't been able to really have a set goal of this is what I'm going to accomplish next and how I'm going to do that. They have to tolerate some of that ambiguity and fight with the tension of like goal-oriented behavior that comes forward with, I've got this new job or this new school and I want to accomplish these things. But on the other hand, I've done my time in the Army, I've earned the right to be not told what to do. And that results in sort of this in-between with lack of structure. And so working through that with them, trying to get them to see like, here is how you will establish that structure. Here are the things that you want to make sure are in there for your big rocks as you continue to move forward. With that, I think we'll go ahead and turn it over to our other panelists. I don't want to take up too much time, but thank you for the opportunity to present today, and let me know if you've got any other questions.
Awesome, thanks, Tim. Yeah, and so next we're going to be hearing from Adrienne Weede, who's from the Transition and Care Management team.
Great, thank you. How's my audio?
Good.
Okay, terrific. Hi, everyone. I am the National Program Manager for the Transition and Care Management Program. Next slide. Transition and Care Management, the program is within Transition and Care Management Services that actually includes two programs, TCM for short, and the VA Liaison program. So in the early part of Operation Enduring Freedom and Operation Iraqi Freedom, service members were returning with severe injuries and serious illnesses. And there was a great need for supporting these service members as they transitioned out of the military and into VA healthcare. So in 2003, TCMS started out with VA Liaisons for healthcare who were embedded at military treatment facilities where we had the highest concentrations of severely injured and seriously ill service members. And then from there, a VA POC was added at each VA medical center, someone who could receive the warm handoff from the VA liaisons. And in this way, this was really the beginning infrastructure to develop a bridge between the DoD and VA to better support our transitioning service members. Coincidentally, I was a social work intern back in 2003 at the Greater Los Angeles VA, and my instructor there was assigned to the role of VA POC. So all of the OIF and OEF combat veterans were referred to him. And it seemed like from one week to the next, the average age of veterans we served in this area transitioned from mid-50s to early 20s. And this was a major shift for this program area as well as the VA. Over time, our organization recognized that combat veterans who were not severely injured and seriously ill may also have complex care or social needs. So the program's evolved further to keep pace with veterans' needs. As Dr. Hoyt mentioned, a number of the issues that can arise and challenges that people may experience while in transition, there's one mission of the VA is to address social needs and provide support in this area. So the VA liaisons, the number of VA liaisons embedded at MTS increased, and so did the number of MTS where they were embedded. TCM Teams also expanded to include advanced practice licensed clinical social workers and nurse case managers, and a transition patient advocate who could support veterans with their reintegration needs. And then as the conflicts have wound down, the scope of these programs has expanded. And since 2016, we serve any transitioning service member and post 9/11 era veteran who benefit from the extra support. Next slide. So start with expanding on the VA liaison role and then move to the TCM program. This slide is a snapshot of their responsibilities. We currently have 43 VA liaisons for healthcare at 21 DoD military treatment facilities. 4 of these members also serve as Warrior Care Network VA liaisons supporting post 9/11 era veterans transition of care from 4 academic medical centers to VA medical centers, and I'll expand on that in a couple of slides. We refer to our VA liaisons as bilingual. They speak both VA and DoD. The acronyms alone, I think, can make you feel like you're speaking 2 foreign languages or hearing 2 foreign languages. So it's been terrific in terms of ensuring that we have cultural competence, military cultural competency, VA cultural competency to best support this particular subset of our veterans. VA liaisons are also advanced practice and licensed social workers and registered nurses. So one thing that is an extra service provided by TCMS is that many of the staff that are supporting transitioning service members and the newest generation of veterans are clinical. In the program, VA Liaison program, being embedded with DoD, enables them to provide critical early connection to VA for service members in the transition process. Simply, you cannot get more proactive than serving service members before they can become veterans. And this has helped so many service members access VA care in a timely manner and a more seamless way. And since the program's inception, VA liaisons have transition care for over 123,000 service members. Next slide. So this is a nice map showing you all of the 21 military treatment facilities where our VA liaisons are currently located. Next slide. As part of the current expansion that's underway is the addition of 5 virtual VA liaisons who will provide regional coverage. And this will include supporting DoD MTS that do not have VA liaisons on site. If you're a potential referral source, I'll show you at the end how to get connected with a VA liaison, be it virtual or on-site at MTS. Next slide. So I mentioned our VA liaisons that support the Warrior Care Network. This is a public-private partnership between the Wounded Warrior Project, VA, and 4 academic medical centers. Each of the AMCs provide a 2 to 3 week intensive outpatient program that serves veterans living with PTSD, traumatic brain injury, and other related conditions. The VA liaisons provide direct access to VA for veterans participating in the WCN by transitioning their care between the AMCs to the VA healthcare system. And then the TCM teams are on the receiving end of these handoffs and coordinate care for these veterans as they're entering the VA healthcare system. Next slide. So our TCM teams maintain expertise in service member and veteran reintegration through their post-deployment care training. They are, as I mentioned, at every VA medical center. They provide a proactive screening to all post 9/11 era service members and veterans who are new to a VA healthcare system. And for transitioning service members and veterans with complex care or social needs, the case manager may assume a lead coordinator role and assist with assessing, monitoring, these are components of case management, coordinating care, educating, advocating, and facilitating their access to services and benefits. The intervention really depends on the person's individualized needs. The TCM teams also maintain a myriad of partnerships with VA and the community programs, as well as local DoD units. So at the local level, these partnerships are in place to support the ultimate goal of providing a web of support for our service members and veterans as they leave the military. At the national level, we have partnerships with DoD's In Transition program, as well as VBA's Solid Start program. These national level partnerships are in place to standardize services to the greatest extent possible and ensure we have infrastructure in place that provides a great and standardized approach to transitioning service member support. Next slide. Okay, so VA has come a long way with respect to data collection and analytics. TCM teams use a national data tool that accurately and efficiently identifies all of the service members and post-9/11 era veterans who are new to a VA healthcare system. This is still a relatively new tool to us and has been incredibly impactful in terms of innovating the program and enabling teams to focus their interventions. As I mentioned earlier, I mentioned about identifying early risk factors. This reporting tool shows who have and have not been screened for case management, screened for post-deployment health concerns, including PTSD and depression, TBI, and military sexual trauma. TCM teams monitor the dashboard that's updated daily and can target their outreach and interventions based on the information provided. Next slide. So feedback from our veterans over the years has showed that when they had one point of contact with the VA, their experience of accessing care was greatly improved. The CMRT, or Care Review Team, has been an invaluable tool used by our TCM teams for the post-9/11 era veteran population. So TCM is one specialty case management program within VA, but veterans with multiple care needs may access care across the continuum and may work with multiple case managers. And by assembling multiple case management programs or services into one room to review veterans' care plans, together the care team members can determine who will be the best fit as lead coordinator. The lead coordinator is a person who serves as the main point of contact for that veteran and their family and or caregiver, and really oversees their overall care planning and ensures that it's holistic, veteran-centered, and that that veteran has access to VA services that are most pertinent to them at that time. Implementation of the CRTs and the lead coordinator has greatly improved the veteran experience, their safety, and ability to access VA healthcare services. It's actually being expanded beyond TCM, and we're trying to weave it into the overall infrastructure of VA so that as veterans move across the continuum, not only post-9/11 era veterans, but all veterans, that they can have a lead coordinator appointed who can oversee their care planning and care coordination. Next slide. So we have multiple sites that are external, and so that you don't have to be within the VA to access them. To obtain a list and a map of the TCM teams, there's a hyperlink there, as well as a contact information for our VA liaisons for healthcare, including the virtual liaisons. And then I'm in that CM liaison group. We have a 5-member national program team that supports TCMS, and that's how you would get in touch with me or another member of our national team.
Awesome. Thanks,
and I'm going to
Adrienne.
hand it off to our last speaker.
Yeah. Yeah, last speaker, and I get the pleasure of condensing my time down, but I'll be the first to say I think the punishment fits the crime. And so I'll be talking about the clinical considerations on the VA side, and this by no means is meant to be a all-inclusive discussion of how to treat returning veterans or transitional veterans, but more ways to think about approaching the issues as well as kind of thinking about how you might broach those topics sitting across from somebody in the room. So the first thing we want to think about is that the key challenges in a lot of these transitions aren't going to be the obvious kind of clinical issues that we might think of as clinicians. So the top ones that come up are difficulty navigating the VA system. It's a large bureaucracy. There's a lot of paperwork. It can be really confusing, and that's why these programs are really helpful by kind of getting people in the right direction, being able to link to accurate website to get the right form. But you're looking at a lot of these issues, getting a job, socializing the civilian culture, financial challenges. These are things that we would expect that most people might struggle with during a major role transition. And so one of the key things to start to think about is what is that normal kind of struggle or growing pain that you might experience, and when does it get into that more kind of clinical issue? So thinking about what normative challenges might look like, and Tim hit on a lot of these, and thinking that one of the biggest things is that kind of culture shock. So one day you're a soldier, you're an airman, you're a Marine, and then the next you're a civilian. What does it take to readjust to that? The communication, being able to change how you speak to people. Tim mentioned that loss of structure, but not having that kind of, knowing what's next, or even having someone tell you what's next, and being able to kind of, reestablish your own goals and set your own kind of limits can be challenging. And, we see a lot of interpersonal difficulties. So being able to share experiences with others can be hard. And we're not talking about, combat things. We're talking about everyday experiences. Just learning how to communicate that can be really challenging, especially when it comes to spouses or children. Learning how to speak is a different experience. And then of course we have that isolation or the loss of community. And this is something that we see a lot. If anyone's ever read Tribe by Sebastian Junger, it's all about that loss of community that creates such an emptiness. And a lot of people have difficulty filling that void. And then just, thinking about shifting family dynamics. If you were employed full-time in the military, you were deployed, there's going to be some alterations in how the family lays out. And so if you're dropped right back in, your spouse might have taken over roles that you previously had. And so it's about learning how to adjust and how to calibrate your own kind of role within the larger family. And likewise, we're thinking about things like, we've talked a lot about entering the workforce, those challenges of translating skills, knowing how to sell yourself, how to market yourself, or leverage your advantages to try and get a good job or good career. So then we're thinking about what are those more kind of clinical issues that come up. So this is data coming from the Veterans Metric Initiative, which is, I think, one of the first longitudinal studies of transitional veterans. So this was done, data collected 3 months after a large group of veterans had discharged, and they used a survey just asking them, what are the issues that you're struggling with? So these aren't clinical diagnoses, these are kind of self-report, but looking at the most commonly reported issues, we've got things like chronic pain, which matches up. If we look at the number one reason, or the number one type of clinical visit in the VA, it's musculoskeletal issues. So this makes sense. Sleep issues, very common. Anxiety, depression, followed by arthritis, hearing loss, and PTSD. These were the most common clinical issues that were reported in that sample. And this was a fairly rigorous, well-distributed sampling technique. So if we're thinking about how this might look in the general transitional veteran population, these are the things that we want to keep in our mind of, if I want to treat this person and treat what's helpful, these are the things I want to look at. And again, thinking about that someone's not always going to come and sit across from you and say, hey, I've got depression or I've got anxiety. It might be, I'm not able to talk with my wife. It might be, I don't feel anything when my kid hugs me. And so one of the things to really think about is being able to set that rapport, being able to have that communication. So a little bit over VA mental health services. I'm going to skip this slide because I think Adrienne covered it pretty well, but just a lot of the different clinics that we have at the VA, providing specialty care. And really wanted to spend the rest of the time talking about these kind of clinical considerations. So one of the biggest ones is just taking the time to get to know the person across from you, providing education on therapy. A lot of people active duty might have a negative view of the therapist or how therapy might play a role. So letting them know, hey, this is what the VA looks like. This is who I report to. This is where your information's going. Let them ask questions, give them a chance to help understand that whole process. Validate and normalize those readjustment challenges. Let them know that this is something that a lot of people go through. And part of this is letting them know you're not the only one. You're not the one that's going through this by yourself. This is a major transition. These changes, these growing pains are normal. Using technology. So this is especially for younger veterans, utilizing electronic medical records. If you're in the VA, we're able to look at some DoD notes, but looking at how can we get people in here. So I guess everyone's doing telehealth nowadays, but being able to use that to pull people in, a wider catchment. And then one of the big pieces that I really want to emphasize is this idea of whole health care. So involving not just the direct veteran themselves, but the larger family, being able to pull in different care teams. That's going to be where this new type of treatment is going to really pay off, for those patient-aligned care teams. And of course, just like any clinical interaction, assessing risk early, assessing risk often, and being comfortable with having those discussions. And then I just wanted to spend a brief second talking about, we've got those main issues that are coming up. And for each one of these, we have evidence-based treatments that work. And so familiarizing yourself with, if someone comes into my office and they've got XYZ condition, thinking about what am I going to use to help treat them? What is the best practice for dealing with this? And so these are some of the ones that come from the VA DoD clinical practice guidelines, as well as APA Division 12 clinical recommendations. And so I'm not going to go through each of these, since, I'm assuming most of you are clinicians fairly familiar with these. But thinking about, when someone comes in, what's in your toolbox? What's in your arsenal that you can pull out to help them with? And being familiar with these and knowing these resources can be really helpful in deciding how you want to treat that person, and doing it from an evidence-based perspective. And this last slide is just kind of tying in that idea of pulling in the veteran, seeing where they are from that broader psychosocial lens, and understanding that there's more going on than what you might be seeing across from you. So really pulling in that whole health care, thinking about the family, the community, and the broader kind of social context as well. So we have about 5 minutes, maybe less, for questions. So why don't I pull up the Q&A. So we've got some questions. So a question of, is this for all branches of the military on all bases? I'm assuming that one is for the transition programs. So Nate, do you want to take that one?
Yes, it's offered through all the branches and should be available on all installations. That being said, there will be variation. If you're at the Pentagon, certainly you'll have more resources than if you're at Fort Swampy in the middle of nowhere. But they will offer training. If not at your installation, you have to go through it. So you will be sent to another one that is offering those classes. But yes, to all, with variations among it. But yes, Coast Guard as well.
Yeah, and we got another one. The subcultures question. Someone was asking about looking at different subcultures within the military. That's a great topic. Looking at different occupations, different branches of service. Obviously there's enough meat in these topics to have a whole presentation on that. But yeah, definitely looking at those subgroups, kind of cultural, social subgroups as well.
If I can add to that, one thing, a criticism, and we get suggestions, Congress gets suggestions on how to improve it, and they're saying you should individualize the program. adapt it to the unique cultures. It's 200,000 people a year on every continent on the planet. How do you individualize that when it's an 8-hour training class to give someone the basics? One thing I want to emphasize when you work with your clients is the way it gets into, the DoD will try to provide as much information to each individual's needs, but the big thing I'd want to drive home as you work with your clients is they have to own their transition and their life. And it is an issue that comes up. We talked about the culture that in the military, it's a paternalistic organization that took care of you. You didn't have to think about where you're going, where you're going to live, and that all changes. And one thing that a lot of the service members think they've done a job search when they go to a career fair or sent out, a couple of web pages. And it's really, if you read What Color Is Your Parachute, the informational interviewing, you've got to really own your transition. This is another question from Emily about the TAP counselors. If it's a good counselor and they have a member who doesn't know what they're doing, we do like Cooter and other assessment tests and evaluations of what you like about your military occupation. But again, the service member has to own it, has to reach out, has to do the work. They're not just going to have a half-hour meeting and get their life's purpose. They have to go home, do the homework assignments. If you've got that 1 year to think about it, do some informational interviewing, do some phone calls. Again, the military, if you say you're going to do an informational interview for lunch and leave the base, your commander should let you. Use that time that you're still getting paid to explore and think about what you're doing and what you're not doing. In terms of cultural, we do try and adapt to all the cultures. Like the services themselves will do the training. So the Marine Corps will provide training to Marines, Army handles the Army, and they have unique things for their population. But really work with your member, your client, to get them to own it. As part of that, Brian had mentioned Tribe, the younger book. That's a big thing that we're finding that relates to mental health, is that loss of the sense of purpose. Having a mission-centered life, which is almost endemic throughout the military community, that is one of the biggest things that will help with mental health, is they've got to find a new sense of purpose. For many people, that's employment. For someone else, it might be a personal mission. It might be their religious affiliation, church, synagogue, etc. But as of this year, there really is a big push in the curriculum about, tribe is important. Find a community that you can work in. And I also mentioned the psychosocial point that you'd mentioned. There is research on the psychosocial benefits of employment and education, of being able to impact PTSD symptoms. I've seen research that looks at employment versus medication, and the reduction in symptoms is virtually identical, except when you take medication, you can wear off and they reemerge. Employment, they stay down. So even if you have a client with severe PTSD, TBI, depression, really we recommend employment is a good tool in their arsenal to help with the symptoms. And VA has amazing programs, even as part of their rehabilitation program. DoD offers training. A question came about being disabled. If they're still in uniform, if you remember nothing else about this call other than what Tim said in transition, if they're injured and still in uniform, have them reach to cap.mil, Computer Accommodations Program.mil. If they start the process while in uniform, they will get free accommodative technology. CAP will also give guidance to employers on how to accommodate different disabilities. But if it's the day after they transition, they don't get the free stuff. And if this costs thousands of dollars, it's no small thing. But CAP will either give you advice on how you can get a job and how to adapt to jobs you can work, or in uniform, give you the equipment that you take with you when you leave. But that can help for for the wounded warriors. Over.
Yeah, and so we're actually a little bit over our time. If there are additional questions, I think most of us have entered our email addresses in the chat. Please feel free to follow up with any of us. Tiffany's also posted the link to get your CE credit, so make sure to fill out the survey there. Thank you all so much for coming out today and for attending the webinar, sticking around. And yeah, reach out if you have any other questions. I'll go ahead and start.